So, hello guys, this is Dr. Aditi Sinha, and today we are going to talk on a topic which is very common among everyone, that is the dental cleaning or the scaling, yet many people are not aware of it. So, here we will talk on three topics: what is dental scaling, how we do it, when we should do it, or it prevents us from what kind of dental disorders. So, the dental cleaning or the scaling is a procedure which cleans our teeth or the mouth thoroughly, which is not possible by regular brushing or the flossing of the tooth. So for that we need a scaler, ultrasonic scaler. We use ultrasonic scaler to clean our mouth thoroughly. It cleans in a subgingival as well as a supragingival level. It means subgingival is little deepened cleaning, or supragingival is just a superficial cleaning of the teeth. As I said, it is not possible with regular brushing or the flossing of the tooth. So next question is why we should do it. The answer is itself, like it's the cleaning is very important to maintain the proper hygiene of the tooth. Otherwise, the debris will build up in our tooth, and it will get a vegetation for bacteria, and bacteria buildup will be there. There will be plaque, there will be calculus, which will leads to other periodontal problems. So it is very necessary to get clean our tooth. So the second question arises, why we should do it. The answer is that tooth is not get properly cleaned with the help of only brush and flossing, so we need proper scaling as well, because if our tooth is not properly cleaned, there will be plaque accumulation, calculus accumulations, which further leads to bacteria vegetation, which leads to different kinds of dental disorders like periodontal problem. It may lead to gingivitis, weakening of tooth, etc. and etc. So the scaling is very much necessary. And now the second question is, after why, when we should do it. In normal terms, we will say it is very necessary to get clean your tooth thoroughly with a dentist, with the help of a dentist, after every 6 months. It means in every 1 year you should get your tooth cleaned 2 to 3 times. Sometimes it may be 3 as well. If you do not properly clean your tooth and you are very much lazy in maintaining the proper hygiene of the tooth, you need 3 times as well. But 2 times is at least needed in a year to for scaling, okay? And afterwards the third question arises. I'm just wondering while recording these things why I'm stammering or something. Let it be, that's kind of bloopers. So the third question arises, that what kind of disorders the scaling prevents us from. Yeah, this is a very interesting question actually. See, what happened if there is food debris in our mouth, okay? In mouth, or you can say on any surface of the tooth. It leads to a vegetation for bacteria. Bacteria accumulates over there, and further it will leads to plaque formation, uh, calculus formation, and the bacteria with their reproduction, it will continue degrading your gingiva, which leads to loosening of the tooth. Obviously your tooth is held in the alveolar bone with the help of gingiva, periodontal ligaments, alveolar bone, okay? So if there is more bacteria, they will continue degrading your oral mucosa, gingiva, everything, right? So further it will lead to periodontal problem, which will make your tooth first ugly, second it will get loosened. It means mobile हो जाएगा आपका tooth. It will continue like क्या उसको बोलेंगे हिंदी में, हिलने लगेगा आपका tooth. That we will call it as a mobility of tooth. Mobility के बाद bleeding, there will be bleeding in the gingiva, okay? And before bleeding will be before, afterwards you have mobility, your tooth will come out, you will have periodontitis, inflammation across the gingiva. You can see that there will be gingival recession, means the okay, sorry, that's also a glitch. Let it be, mic is not working properly. Okay, the gingiva is covering our tooth, right? So the gingiva will go down. If there is plaque accumulation, there will be calculus, there will be recession. Recession means the gingiva will go down, and more surface of your tooth will be visible in the oral mucosa, which leads to sensitivity. Again, the periodontal problem. Actually, you don't know. Let me clarify this thing. Periodontal problem, which if you will ignore your periodontal problem, right? It will eventually leads to medical issues as well, which I will explain on later on. So if you want to save your teeth, obviously yaar, people are like दांत ही तो है. See, talk to a person who is in his or her young age and he or she doesn't have tooth because of any issues, maybe some kind of disorders, maybe because of any sort of accident, he or she lost her tooth or his tooth. So ask from them what kind of problems they used to feel without teeth. First, यार confidence नहीं है यार. Obviously, look, if you don't have teeth, you have or irregular teeth, or you don't feel like confident, right? How you will feel confident? No, you will not feel, right? Aesthetic, which is that aesthetic is very necessary nowadays. People are like, no ma'am, I need well aligned teeth, I need. So ये जो हम लोग का है, लोगों में awareness बढ़ रहा है, but yet there are many people who are not aware of everything, these kind of things. Not at all. So aesthetic बहुत ज़्यादा importance रखता है. आपका confidence level in whichever field you are from business, you are doing corporate job, you are from any field, looks तो matter करेंगे ना, looks तो matter करेंगे. No, and now you will say doctor हो के तुम ऐसी बात बोल रही हो कि looks matter करते हैं. Yeah, I'll say it again and again, like look matters. See, if you will talk to someone for anything, for a normal conversation, for business meetings, for getting job or anything, you will see his or her look at first. Without looks, you will not even go to that person, oh I should talk to that person or not. Once you will feel like, I am attracted to that person, you will talk. And उसके बाद उसका नेचर बिहेवियर मैटर करेगा, क्योंकि अगर वो आपको देखने में ही नहीं अच्छा लगेगा तो यू विल नॉट इवन गो टू दैट पर्सन, राइट? तो आपको पता ही नहीं चलेगा हाउ ही और शी इज. सो फर्स्ट ऑफ ऑल लुक मैटर्स. या ये मिथ बिल्कुल भी किसी को बोलने मत देना, लुक्स डजंट मैटर. इट मैटर्स, एवरीथिंग मैटर. ये सब बातों में बिल्कुल मत जाना कि ये लुक वुक मैटर नहीं करता. ये सब बेवकूफ़ बनाने वाली बातें होती है. इट डेफिनेटली मैटर्स. सो लेट्स गेट टू द टॉपिक वंस अगेन. ये तो हो गया हम लोग का एस्थेटिक के लिए होता है. फिर अगर टूथ नहीं रहेगा तो देयर विल बी सम प्रॉब्लम्स, लाइक यू विल नॉट एबल टू च्यू अ फूड. आगे का दांत नहीं रहेगा तो यू विल नॉट एबल टू कट. ऑब्वियसली एंटीरियर्स आर देयर टू कट एनीथिंग. कट नहीं कर पाओगे, वो प्रॉब्लम हो जाएगा. बैक का टूथ नहीं रहेगा तो देन यू विल हैव प्रॉब्लम्स इन च्यूइंग. सो जब दांत नहीं रहेगा, यू जस्ट इमेजिन यू विल नॉट एबल टू ईट वॉट एवर यू वॉन्ट टू. यू आर गेटिंग माई पॉइंट. And moreover, when you will see anyone who doesn't have tooth for a long period of time, जैसे हमारे दादा दादी को देखते होंगे आप लोग, तो उनके जो ये लिप्स होते हैं या फिर चीक होते हैं वो संकन हो जाते हैं, ड्रूलिंग करने लगते हैं. इट विल बी लाइक, ये तो मेरे में नहीं हो पा रहा है. यू विल नॉट हैव टूथ, योर लिप्स डजंट हैव एनी काइंड ऑफ सपोर्ट. इट विल बी लाइक संकन, ऐसे टाइप से अजीब टाइप से हो जाएगा. यू विल फील इट, राइट? योर लिप्स डजंट हैव सपोर्ट, योर चीक्स डजंट हैव सपोर्ट. तो इट मैटर्स. एंड मोस्ट इम्पॉर्टेंटली, आप अगर दांत नहीं रहेगा, आप खा ही नहीं पाओगे प्रॉपरली, च्यू ही नहीं कर पाओगे, तो आपको ऑलमोस्ट फिर प्रॉपर डाइट नहीं लोगे, देन प्रॉब्लम्स विल कम, राइट? सो जस्ट थिंक अबाउट इट. गेट योर टीथ क्लीन्ड after every 6 months, please. At least get a thorough dental checkup as well. Suppose that you have any problem and you are not aware of it, it may leads to further more problems, right? Get it cleaned. Don't take it for granted. Please don't take your teeth for granted. I am telling you, because once you will lose it, it will be like gone, man. Because tooth is only structure in our body which is not healed by itself. टूथ खुद से ठीक नहीं होता है. सपोज यू हैव अ कट इन आवर बॉडी, एनीवेयर, it will be healed eventually, okay? But tooth, it doesn't have its capacity to heal by itself. Once its enamel, its dentine, its surface get eroded, it will be eroded. You will get it fixed, right? Take care of your teeth. So please guys, here we end this video. Like, share, subscribe. I'll come with these kind of videos. Hopefully, you can relate it. Sometimes I make funny faces as well. Let it be. And that's my way of making videos. Hope you will like it. Thumbs up, like, share, subscribe, comment. Thank you. We will see in next video. Okay. Hopefully this time I will not stammer.